Thanks so much everyone for watching. We've got an epic lineup tonight of speakers. We've got an awesome panel here. Amazing group of functional doctors, technology, activists, for a leap forward in medicine.
You know, our goal is to make it easy for practitioners to learn in community.
This ecosystem that has been set up by the meetup groups, we believe will be the future ecosystem of this evolved primary care network, and it all revolves around you.
Welcome to the Functional Forum.
Thanks so much everyone for watching.
Joining us
We've
in the
got an
charge
epic
to
lineup
accelerate
tonight
the
of
evolution
speakers.
of
We've
medicine.
got an awesome panel
Please
here.
welcome
Amazing
your
group
host,
of functional
Jay.
doctors, technology, activists, for a leap forward in medicine.
You know, our goal is to
Hi everyone, welcome to the Functional Forum. Hey, how you doing? This is the Functional Forum episode 102. And tonight we are going to be speaking about lipid replacement therapy and fatigue. So super excited to welcome everyone here tonight to the show. We've got a really good show. It's going to be a lot of great clinical information. This has become the most important topic in medicine over the last year and a half because, we see that for a long time, doctors in functional integrated medicine were on the front lines of dealing with chronic manifestations of acute infections. So for a long time, we've had over the last few years, and few shows, we did a show on mold toxicity and mold-borne illness. We did a show on Lyme disease with, some of the top people in the country. And tonight, one topic that keeps on coming up is this topic about lipid replacement therapy and its effectiveness in working with patients with those kinds of conditions. So I'm super excited tonight to have Dr. Rita Ellithorpe, who is going to be joining us. Welcome, Dr. Ellithorpe. She is a leading educator in the functional medicine space, a leading clinician, seeing a lot of chronic illness. And Dr. Ellithorpe, great to have you here on tonight. I think you're still on mute, but if you're not anymore, how are you doing?
I'm doing very well. Thank you so much for having me.
I'm excited. So later in the show, we're going to get into all of the specifics of some of your protocols, how you use lipid replacement therapy, some of the patients you work with. But I want to kick off tonight just by sharing a little bit of what we normally start with here. Just a little word from where we are. So tonight is live. And so I'm here with Dr. Ellithorpe. You can actually ask questions for Dr. Ellithorpe here and on Twitter with hashtag functional forum. So I'm going to be monitoring that. So you can tweet me right now if you have questions already. You can tweet for Dr. Ellithorpe later, and hopefully Dr. Nicholson as well. We're just waiting to see if we can get Dr. Nicholson on. But right now, Dr. Ellithorpe's on, so please feel free to send over some questions via Twitter. Now, obviously, one of the big things that we're doing here at the Functional Forum is bringing together community. So we'll get into that here shortly as we move along. So let's jump into it now. So I want to start off with a special interview that I recorded a few months ago from Dr. Michael Ash. So Dr. Ash is one of the leading physicians in functional medicine. He brought functional medicine to the UK. He's been putting on the IFM conferences for years. And I interviewed him recently. He wanted to be on live here, but actually it's 2 a.m. in the UK. So he can't be with us here. But Dr. Michael Ash is, one of the 2 leading educators in this space and actually created a lot of the research and a lot of the papers on lipid replacement therapy. So we're going to start with sort of like the physiology and the foundations. So here, let's kick it off with Dr. Michael Ash. I'm really excited to have you on here. We've spent a lot of time together over the last, few years at different events and, all the trailblazing that you've done in the UK to bring functional medicine there and educate, the physicians, and just really excited to actually dive into a clinical topic with you and a topic that I know that you've had a lot of experience with. And I think we're going to talk about lipid replacement therapy here today, but I guess maybe we'll just start at the sort of the level of the physiology of the cell. And, this lipid replacement therapy has sort of become, quite en vogue recently. But I want to just maybe start with the physiology of why this is important and what's happening in the cell that means that we need to replace these lipids.
Sure. Well, I think let's just contextualize this a little bit. Came into this world of therapeutic intervention through clinical need, but much of my initial work hinges on some very significant papers that were published in the early 1970s, of which my co-author on virtually all the papers that we've written about this subject, Garth Nicolson, Professor Nicholson, wrote The Fluid Mosaic of the Membrane and described that the membrane wasn't simply two walls with something squished in between the middle, that there was a matrix, a fluid movement of proteins, lipids, and other messenger molecules that could be influenced ultimately by exposure to either adverse events or beneficial intakes of lipids. It got refined a couple of years later. And what's remarkable is that most scientific models do evolve over time, but here we are just over 40 years since that paper was published. And the vast majority at the nanoscale that Garth and his co-author Singer wrote about at the time is still very valid. And I listened to Garth give a presentation, I think in about 2012, even more earlier than that probably, looking at the way that lipids were involved in treating people with persistent fatigue. And my work for many, many years was involved in the aberration of energy production due to immune insult, leading to a cascade of consequences that led to mitochondrial membrane oxidation. And so he and I sat down and had lunch together afterwards, and we started to explore the idea of doing a lipid replacement therapy utilizing an oral supplement rather than an intravenous phosphatidylserine or phosphatidylcholine process, which had been explored for a number of years and had been written about many times. So very simply, the membranes around all of our cells have a degree of capacity to flex and bend, which allows those cells to become curved. They have an inner membrane and an outer membrane. And inside those membranes are embedded various molecules, proteins, lipids, fats. And then inside there are rafts or congregations of lipids. And all of these agents flex and bend. And the healthier we are, in very simple terms, the more flexible and the greater ability we have to renew those lipids than when we're unhealthy. And there are many explanations that you can follow through for almost every disease, whether it's a chronic or an acute disease, that leads to changes in membrane fluidity. And so what we began to explore was the idea that you could take an oral supplement that would be transported across the small intestinal barrier and then disperse in different forms throughout the body so that cells that were in need of renewal could take those lipids into the membranes and return the fluidity and flexibility. So in very simple biochemical terms, the concept is to improve both the cell membrane and then ultimately, as we'll get into a bit more detail, the inner mitochondrial membrane as well.
So why do some cells become in need?
Well, the simplest one of all is that as we age, we are less efficient at replacing both the primary cell membrane molecules, the fats and lipids, and secondly, that the inner workings of the cell, which are the mitochondria that we're going to refer to, rely on a large part of both regeneration and recycling, which requires us to provide a certain form of different fractions of lipids. So you can have infection, you can have insult, you can have stress, you can have aging, you can have environmental triggers. Everything that we in the functional medicine community would regard within the matrix has as a consequence an event at the lipid barrier. And if we're very healthy, it's a short-term transition in which the lipids might become stiffer or more permeable or less permeable, and they can be corrected through lifestyle and dietary interventions, all of which are relevant to what we're going to be talking about, because although we're talking about an oral replacement therapy, it has its limitations operating in isolation. It has to be combined with all the other strategies that we're familiar with in the functional medicine model.
Interesting. So, you know, in a sort of a normal, healthy environment, would these be being replaced by dietary fat?
Yeah. So essentially, you can take in, whether it be animal fat or plant fats, as long as they're broken down into their constituent components, they will be utilized by cell membranes. And I think we're all familiar with the idea that oxidized fats are generally seen to be therapeutically disadvantageous, whereas unoxidized fats, which are flexible and can be bound into membranes, confer an advantage. The concept that we simply have a more flexible membrane underestimates the importance in terms of human functionality. So in order for your brain, your liver, your kidneys, any tissue in your body to be able to operate, to be able to transfer messages, to be able to move proteins or fats in and out, to flex, they require some capacity to renew those lipids on a regular basis. And what we began to see 20 odd years ago was that people with persistent fatigue seem to have an immune response. It's often very difficult to quantify, but it's possible to look for certain cytokine markers in patients who have, initially I was exploring predominantly people with persistent unrelenting fatigue. We could find that certain cytokine profiles were raised, in particular interleukin-1 and TNF-alpha, which suggested either that there was an infection or some form of insult was taking place. And the consequence of that was a raised level of defense mechanisms, which are very tiring. If you want to defend yourself, everyone knows that feeling. We get a tickle in the throat. It's very hard to maintain that same level of energy when your body is effectively distributing energy towards the production of either white blood cells or other types of mechanisms to defend you. And whilst in the early days, it was difficult to quantify what that might be, I began to piece together, and Garth's work really helped to pull this into some form of clinical strategy, that there may be what we call a sterile inflammatory event. And this has been looked at now for the last 10 or 15 years, where particulates from these cell membranes and also from the inner membranes of the mitochondria are oxidized because of an insult to their structural flexibility. And they then distribute themselves around the body and are recognized by pattern recognition receptors as being problematic. The attempt to eliminate them is a normal process of clearance from the body, either back into the stool, to the urine, to the liver, to the kidneys, and so on. But if they continue to be produced on a regular basis, the energy necessary to do that becomes depleting. And it's very difficult in order for that person to recover from either the original insult where they get post-viral fatigue, for example, long COVID. For Garth will recently been writing about the fact that long COVID is a classic example where we see persistent sterile inflammatory consequences of the original insult. So looking at the very delicate membranes inside mitochondria, where they rely on cardiolipin, or the membranes of the cell where there's a wide range of glycerophospholipids that make up those areas, an opportunity to replace them with undamaged, unoxidized lipids therapeutically suggested that there should be a benefit.
Great. Yeah, that makes a lot of sense. So what were your first forays into, into providing this orally, and how did it go, and what did you learn along the way as far as like what was because I'm sure you're sort of like, you're sort of just going on your understanding of the physiology and what you think might work. And then when you start doing it, I'm sure you learn a lot.
Yeah, of course. And I think there are, as with all interventions, there's normally a parameter that allows you to derive some benefit without being too problematic. I mean, there are sort of extremes where it's either too little, and so the person becomes disaffected and disillusioned, or you give too much. And so over the years of using this, there's a rough rule of thumb, something between 2 and 6 grams per day of lipids, of which from a commercial perspective, there's a company called Natural Therapeutics that has been producing these lipids under Garth's instruction now for a number of years. We would use it either as a powder or a tablet or a capsule. So we can deliver it either on their own or in conjunction with various antioxidants or other nutrients, which appear to also benefit from a transporter mechanism. So the lipids themselves seem to provide additional capacity for the cell membrane to allow those nutrients, which are sometimes difficult to penetrate fat-soluble tissues, to enter into the cell. So if you give somebody, say for example, we take an individual who's had exposure to some form of environmental toxin, and a lot of work was done via Garth with people from the Gulf War exposure. So much of the work that I first began to read about was people that are being exposed to various noxious chemicals, for which fatigue was a characteristic, but there were many other symptoms, including pain, loss of energy. And I know rather uniquely, Garth is an honorary colonel in the Special Forces of America because of the work that he spent time doing it. One of only 2 people, and the other person was his wife before she passed away. But they were given special military promotions because of the work. And what they found was that they could both drive into the cell nutrients necessary for cellular function to enhance, but they could also excitose or bring out of the cell contaminants. And like all these things, if you try and bring out things that are problematic to render harmless too quickly, the consequences can be that that person ends up feeling worse than they began. So dosing for these things between 2 and 6 grams per day, I think I gave you a few examples. We've published numerous narrative reviews and also co-authored studies on the use of these interventions in different groups of people, from aged people to people with toxic exposure and also people with persistent fatigue, chemotherapy-induced fatigue. There's a variety of different ways. It's terribly easy. I know when we've been writing, we've written thousands of words on this. So there's a lot of technical data. Virtually all of these are free to read, so you can search through PubMed. And we tend to write for fairly dull journals. So they're not the sort of typical journal that the average clinician is going to look at, but things like membranes, and I think we did 2 very long ones for Biochemica, Et Physica Acta, which is a name in itself which you're never going to repeat in a public company. But essentially, these are journals that specialize in lipid dynamics and lipid therapeutics. And we wanted to introduce to these scientific groups and try to encourage more research being done through independent institutions to show how it's possible to basically resuscitate cells and, more importantly, resuscitate mitochondria. And by doing so, you can reverse the age-related changes that occur in all of us. And in doing so, you can not just simply improve energy, which is a fundamental component of all activities that take place, but you can also rid the body of various problematic agents.
All right. Well, if you like that, you can definitely go and check out the whole podcast that I did with Mike Ash. He has been such a leader in this, and with Dr. Nicholson not here, surprisingly, I'm glad that he shared a little bit of Dr. Nicholson's history there of his great work in the Army and, taking this on in a really clear way. So let's just a couple of reminders for you about the Functional Forum in general. Obviously we are here. One of the things we're super excited about is our communities, and we have communities now growing all across the country. And I'll just show a quick map of this, but this is a list of all the communities that we have all across the country now. And in September, we're hoping that all of these communities are going to put on events for their community. We've got the Institute for Functional Medicine coming in strongly behind it and supporting us in getting practitioners together. So we're very excited for all the communities that have been built, and just grateful to all of our partners there. You can see on here, those groups that are running these groups and have been supportive over the years. Lifestyle Matrix Resource Center, FullScript, Avexia Diagnostics, Freedom Practice Coaching, which is running 10 different groups across the country, bringing practitioner communities together. So we're super grateful to all of them. So we're super excited to have Dr. Ellithorpe here. So Doc, I know when we first spoke, understanding fats and how fats contribute to health or disease is something that I know that you've been interested in pretty much for your whole life. So do you want to just share us a little bit about why that is?
Well, I suppose it begins from my childhood. My dad worked for Armor Food Research in the Chicagoland area. And there he was part of the team that was involved in developing the first TV dinners and helping the taste of the meat components to be preserved. And what they found is they had to hydrogenate the fats to stop their oxidation. And so I grew up, I was 4 years old in the research labs learning about fats and diet and marketing. So I grew up in this, and then of course I went down into the sciences and became a doctor, and that brings me to where we are. I remember my father, when I was a child, arguing with my mother about starting these marketed margarine products, these imitation butters, these liquid oils to cook with. And there were arguments in our household all the time. And my father was saying, we will not use these things. We will stick with the old fashioned lard and butter and so forth, and no seed oils in our house. And there were quite a few arguments. So I have grown up in this, and now approaching 70 years, I can see all the wisdom and history there. So naturally, when I became a doctor, and after I finished my military active duty as a physician, then I went on to stay in the terms emerged, functional medicine, integrative medicine, complementary medicine, alternative medicine. So I have lived from my childhood through this whole scenario, and I have seen the small mom and pop vitamin shops that my dad would go to up until the present wonderful training programs such as yours, Mr. Maskell, and what these internet and forum Zoom meetings can do to expand the ability of the clinicians to help their patients. So that's my background.
Yeah, it's really interesting. And yeah, thank you for sharing that. And, obviously there's been a lot of phases of life. And, I'm also particularly struck by your own great health. And obviously there's no better way for a functional medicine doctor than to walk the talk. So, I guess I know you've been involved in functional medicine for a long time, and you've been, done textbooks with Jeff Bland and, sort of been all along the process. I guess I just wanted to ask you specifically about lipid replacement therapy, and sort of when you got connected, when you sort of first heard about it, and what your first ventures into it were, because from my perspective, it sort of just got hot in the last few years, but I know that there's been doctors using it for all kinds of fatigue related chronic illness for a long time.
Well, having the controversy of the cholesterol heart disease hypothesis that really emerged in the late 1970s, early 80s, my dad was integrally involved with trying to assemble scientific papers and work with other PhDs, Dr. Engel from the East Coast, about the importance of cholesterol and the saturated fats and its role in the cell membrane. So you have to understand, I've always been involved in this kind of a genre, and I never was a part of the cholesterol cardiac heart disease hypothesis. And I heard the arguments that were being made and the articles that were being suppressed, you might say, the censorship of the pro-saturated fat value in lifestyle and healthy disease, prevention. So, so my whole life has been involved in standing for grass-fed butter, beef, and these things. And of course, beef is probably along with egg yolks and eggs, the highest source for phospholipids in the diet. And the cholesterol heart disease hypothesis did massive damage to the American health by making people afraid of butter, making them afraid of meat. And I have to separate that because stockyard industrialized raised beef is damaged. It is abused with grains and hormones and antibiotics in the feeds and lack of motility of the animal, all the things that make us a couch potato, make cows couch potatoes as well. And so if we did biopsies of the animals, and that's what my dad was involved in, and we looked at their fatty acid content, we would see that the omega-6 to the omega-3 ratio was 20-1 and very inflammatory and bad to eat. So your knowledge base of your media source or the book you're reading or the video documentary you're watching, you have to see if they're identifying whether they're talking about grass-fed, prairie-raised sources for these rich phospholipid foods in our diet. That's not to say you can't get phospholipids from flaxseed and other seed oils, okay? But it is to say that the amount of phospholipids in these plant sources, although it's there, it's much less reduced. And when you look at the disease compounded with our chronic oxidative stress as a society, our need for a volume of consumption of cell membrane, lipid replacement membrane repair is enormous. So to eat a sole plant-based effort to try and find enough phospholipids to repair your bilipid phospholipid membranes and your intracellular organelle membranes is difficult. I'm not saying it can't be done, but it is difficult. So we've always emphasized with our patients, there's never been a time when I didn't encourage my patients to consider if they were vegetarians to at least eat eggs, and become a lacto-ovarian vegetarian. And in that, I've enjoyed such wonderful, faithful patients, such wonderful patient recoveries or enjoying a better long-term functional lifestyle because of these experiences. I'm not saying I was smart enough. I'm just saying I was in the right place at the right time with my father involved on the side of pro-saturated fat for health. I may have been trained and never saw this side if I wasn't blessed to be in his lab and heard the controversy, even as a 4-year-old, all the way back in the 1950s. So I am grateful for the wonderful people and the shoulders I've stood upon. And so when Garth Nicolson came along and we were trying to create a product that would be consumed to kind of fill up that volume of consumption of phospholipids in the diet that people had missed from eating so few natural sources of eggs that were demonized, meat that was demonized, of course, always grass-fed, wild-caught and stuff. Then I was very interested, and I became very piqued that this is the right direction to go. And so Garth and I and Dr. Ash and the science officer I worked with here was Mr. Bob Centenary, was a scientist, and we all got involved in helping to produce many of these studies that Dr. Ash was referring to, and Garth Nicolson was able to focus, because my focus was on being at work, seeing human beings every day on a schedule, okay? Whereas Garth could work more on getting studies planned, and I would feed him, patients that would qualify for these studies.
Yeah, that's really interesting. So, I guess like pre-2012, you're just seeing these kind of patients and getting them to make these dietary changes, and you see, improvement. Obviously, I think in the functional medicine, everyone's in this world are seeing, significant improvement with just dietary changes. Does the commercialization of these lipids into supplements, does it replace that? Does it speed it up? Like, what effect does it have on the healing?
Yeah, one of the things is we have been using phospholipid replacement as a commercial supplementation. I would say the earliest I can remember using this was back in 1994. that's when we were getting involved in a lot of cancer research and glioblastoma multiforme brain tumors. I was working with Dr. Stanislaw Brzezinski when he was on trial. I ran his clinic in Houston, Texas. And you know, the brain is so full of fat, and the fats for healing in the brain and the treatments, the chemotherapies, the radiation, surgeries on brain tissue, fat was a very necessary component of part of their repair and tolerance of their treatments. So we were bringing this up to Dr. Stanislaw Brzezinski, and I was pushing it back then. And we were fortunate to come across the NT factor, the phospholipid company that was just being developed at that time. And so they compressed this into caplets, multivitamin caplets. And we were pushing that because, and in some cases having to crush it up because they were so ill, many of these brain tumor patients, to help with their cell membrane repair from their treatments from their brain tumors and radiation and such. So we've been using these forms of supplemental phospholipid replacement therapy since at least 40 years. Wow. And I can tell you, it was so wonderful to have these people open their eyes to the cell membrane, to the need for that fat that helps the resiliency and repair, not only to any one organ. I mean, from the moment you're touching your body, from your mouth all the way down through your intestine, that's only one cell membrane thick. And that cell membrane is so easily damaged with the pollution, the toxins, the high fructose corn syrup, high carbohydrates, which create oxidative stress and rip that cell membrane of the lining, which creates a leaky gut, which allows more lipopolysaccharides that are damaging and inflaming endotoxins to come in the body, and creates this cascade of damage to cell membranes all throughout the body. And so it goes, not to mention heavy metals in the air that we're breathing from chemtrails, geostratospheric engineering. But I want to bring up a point as well. You have to do this as I always explain to my patient, it's like having plates. You spin the plates on a pole, and you have to get all 12 plates rolling at the same time. And if one starts wobbling, you got to run over and start doing that. So helping patients to understand their restoration of their energy, their health, is a broad spectrum and requires time with your clinician. This is not a 10-minute or 15-minute office visit. And we need clinicians that will give time to their patients. The minimum time we have with our patients is a half an hour, and we'll easily spend an hour at times. So you have to talk about microcirculation at the same time, because if you want to absorb that fat, of course, you're going to take it in supplementally with this supplemental phospholipid replacement therapy. Talk about the diet that should be your primary source for phospholipids for your enduring health. But you also have to talk about the process of healthy digestion, the gut integrity, and the microcirculation that will take what is absorbed out of the gut and deliver it to the sites of the brain and the peripheral nerves for neuropathies and all these other sites.
Yeah, that's interesting. Well, look, I think that's really powerful information. I guess I just want to talk and bring this to the here and now just for a minute, because obviously in the last year, you've got long COVID, and, Mike mentioned that Garth is very interested in long COVID. So there's your fatigue illness, and a lot of people struggling with fatigue, and, even close to home, I've had, people in my family. But also, I've been contacted by friends who, maybe had no reason to get in contact with me before, who have been struggling with side effects from the COVID vaccines and have had a reactivation of Epstein-Barr, or have had, fatigue-related issues after having the COVID vaccine, deep vein thrombosis, other interesting things off the back of it. And, typically, that's led to a lot of fatigue and a lot of like viral based fatigue. So I guess I just wanted to touch in with you on, sort of, I guess, the current state of your practice, right? Because obviously you're probably seeing those kind of people finding you, and maybe you could just give us an idea of like, what's been your experience in COVID, both, from the infection and from the vaccine side effects. Are you seeing that, of those kind of people entering your practice? And how does your approach with those people, I guess, differ from what you've been doing for 40 years?
I don't think I've changed anything in my practice. Everything has remained the same. We have about 8 physicians, 7-8 physicians working here with a huge staff and nursing. We have an IV suite where we do high-dose vitamin C, we do glutathione IVs, we do EDTA chelation IVs, we do oxygen therapies. But our focus here has always been to take a patient in, no matter where they're at, over the years, and teach them about maintaining health, protecting themselves from environmental toxins, optimizing lifestyles, hormone replacement therapy, these gut replacement healing protocols, exercise, the importance of sleep, reducing the oxidative stress of the high carb diet, high fructose corn syrup. So that's our baseline here for everyone, which means out of the thousands of patients we've had, we had no one die from COVID. And I'm seeing cancer patients who come to me as a consultant for their nutritional repair and therapy alongside their oncologist management for their chemos and treatments and surgery. I have the heart patient who comes in who had a heart attack, a stent, and they want to start doing chelation therapy. So I have all kinds of autoimmune, Parkinson's, cancer patient, obese, diabetic patients from a wide range, from down to, we don't see toddlers or newborns. We'll see children roughly from 4 years old and up to I have some of the oldest population as a physician now. For decades I've been here. So given this wide swath of a general practice, I would say we're probably 60% women, 40% men. Of all these diseases, and not everyone's thin, and many of them are still fighting their diabetes with our lifestyle help. Not one of them, to my knowledge, with our doctors here, was hospitalized. Not one of them died. So we have to say that putting them on vitamin D over the decades, checking those levels, checking high fructose corn syrup levels, checking their HSCRP, their homocysteine levels, looking at EDTA chelation, doing fasting insulin levels for decades. This is nothing new to us. And teaching them about, for instance, I want to show you something, James. See in the back here, I have this picture.
I was actually going to ask you about that because I could see it in the background, but I guess, is this something you're educating your patients on all the time?
Every one of my patients know this picture, and this is a damaged cell bilipid membrane. And this is what we do for decades, is repairing this membrane. And I explained to them about the little particles and the free radicals, and it sits here all the time right in my office so that I can easily talk with my patients. So we have taken the doctors here, not that I know it all, but my passion is for teaching doctors and then birthing them, so to say, into their own practice once they've really develop that strength and how to be an independent doctor. Another picture I have up here, I don't know if you can see it, is this one here, which shows in stick form the bilipid membrane. You can see the top and the bottom. and I point out the cholesterol here. See these cholesterol pieces?
Yeah.
And then I point out the protein, transmembrane protein, and I show these very special fatty acids that are here that have to have their double membranes as opposed to the saturated fatty acids that are here versus cholesterol. So my patients are all educated. They're all absolutely educated. And my doctors here all have these pictures in their office talking about the importance of the structure that we live in. One of my other little things I like to do is I have my foosball here, and I have, for instance, my paper clips, the little paper clip you can see in my foosball. And I say, imagine this is your cell membrane, okay, your cell, and it got injured by one of those, damaging free radical radiation treatment, chemotherapy, and infection, heavy metals. And now you got a hole in your cell and it's not working so well. And so you go and buy some vitamin and you take this vitamin because of independent isolated research, and then you put it in, but it falls right out. So it falls right out the other side. It's a hurting cell. But then I say, what if you wrap it with fat, phospholipid fats, and then you bring it to the cell membrane and put it in with the fat wrapped all around it? The membrane is restored. That thing, I don't know if you can hear it shaking in there, it's not going to fall out, okay? It won't fall out. And so my patients, they get it right away when I'm telling them how important fats are. And that's all the fats. So I'm trying to help doctors on where the tire meets the road level to understand how to communicate what to have image-wise for their patients in their office consultation. What videos, we have a whole sheet where we have, for instance, what do I have here? I keep videos, and some of Garth Nicholson's videos are up here, and Dr. Ash and their work, okay, as well as mine, some of my publications, so that I can help my patient own their lifestyle and own the reason that they're going to say, yes, I will eat some eggs and yolk. Yes, I will eat meat, free range. Yes, I will eat some fish, or I'll eat some chicken with the skin on it where all that healthy fat is. Yes, I will avoid cooking with liquid oils that will hydrogenate the fats from the high pan searing levels, okay? And we'll stick with very saturated fats in our cooking, so we're not getting these oxidized fats in our body. So this is what has helped our clinic and our patients do so well. And I also used early therapeutics. Okay, I was up there with my own YouTube putting out this in March of 20. Okay, the early therapeutics and the value of high dose vitamin C and the value of preventing microclotting with EDTA chelation therapy. And that is something that is woefully not discussed in the integrative community, how important EDTA chelation is in reducing the oxidative damage that hurts these cell membranes, okay? Improves that microcirculation, so when you eat these phospholipids, they reach all these sites.
Yeah, well, look, I guess I just want to say thank you. It's awesome to actually be able to be seeing you in your clinic, because, as I went, before I started the Functional Forum, as I went to hundreds, if not thousands of medical clinics practicing like you do, what I saw is, some clinics had all of the education ready there for their patients. And, it was really easy for them to go through that. Over the last 10 years, we've been helping clinics to, really organize their educational framework so that every patient goes through a very specific education process in their practice, so they're able to, start to learn and, learn self-efficacy, essentially, learn how to take care of yourself, learn, how to take care of yourself in the pandemic. In a minute, I do want to ask you about the way that you dose, these products, and get specific on there for the practitioners who are listening. But I just thought, you mentioned something there about March 2020. In April 2020, we did this session with Jeff Bland and Ari Vojdani. And this was one of the slides that came up there, which was essentially, who's going to get a bad COVID infection and who's going to get a mild infection based on, these areas. So you have, the exposome, right? You mentioned, the amount of pollution, right, that a body has been exposed to, and that's what the exposome is. You mentioned, mucosal immunity, right, with the integrity of the gut. And then you can see, some of these other things like the antibodies, the viral receptor, innate immune response. Some of these are to do with immunosenescence and aging, but obviously a lot of it is to do with like how you take care of yourself and all that time. So it doesn't surprise me that, and I've heard this a number of times, that, doctors in the functional medicine space, and in fact, Dr. Burke, who was on earlier this year, I think she's very proud of the fact that no hospitalizations, no death in her functional medicine practice either, because of, obviously similar kinds of things than you're seeing here. So I guess I just wanted to put that in, because I feel like there's so much wisdom in our community, and yet, it's trying to get out. And I think there's a real demand for it in the patient population, but ultimately there's sort of some blockages to it, reaching everyone who needs it. And part of what we're here to do at the Functional Forum is to sort of shake that out. So can we talk about, you have patients now, you've got them doing the fundamentals, you've educated them, through the process, they're eating better, but you decide that you want to dose some of this phosphatidylcholine, phosphatidylserine, or, lipid replacement therapy. What's your go-to stuff? How do you use it? And how have you sort of come to your protocol over the years, and what sort of individualizes that protocol?
Well, I am using, I don't know if I can show it. I keep them right on my desk. Can I show the product?
Yeah, show whatever you use. I mean, this is your practice.
I keep these on my desk. Okay, these are phospholipid powders. And it's a scoop, okay, per serving. Most people, when they're severely tired or ill, they mix it with some water. It can be room temperature, it can be warm, but not boiling. And which, it doesn't matter. There's about 4 grams per serving in each of these, and it's done about twice a day. So I'm on the upper end than what Dr. Ash was talking. I'm using about 8 grams a day, especially on the initial program, until I can see that they're eating more natural phospholipid rich foods. Okay. And this is, I start with the gut, and I use these powders, but not both, one or the other. Okay. And one is called NT-Factor Energy Lipids, and the other is called BioPC Pro. So these are the powders that I use. And then I usually find that my patients don't think that the cell itself is made up of fat and protein. I usually pinch my cheek while I'm talking to them, just like I'm talking to you. And I know it looks stupid, but I hold my cheek while I'm talking to them. I'm saying, this is soft and wiggly. It's fluid membrane. This is all protein and fat. I said, if this was made of sugar, carbohydrates, it would be hard like rock candy. And then they get it. You see, they get it. This is soft. This is protein. And I tell them, if you need better white blood cell function, a better immune system, you better eat more protein and fat. And so the other thing that I emphasize is richer protein volume in the diet, because I find most of them are way eating too many carbohydrates. Their insulin fasting is too high. I don't agree with the ranges of the laboratory fasting blood sugars. We like our patients to be 85 milligrams per deciliter or less, somewhere between 55 and 85. and they're shocked. My doctor said, I was 99 or I was 104 and I was still normal. And I said, to me, that's pre-diabetic, that's immunosuppressive. So I give them this powder. This is literally the most common thing I do is I take the SBI Protect powder, which has in it these immunoglobulins, and I mix it with the NT powder. And I have them use this morning and evening. And I cannot tell you how many patients think I'm a genius. They come feeling so much better by using this. The other thing I like are the fats that are in what is called Clinicians Preference oils. These are the omega-3, omega-6, which are the very important ones. I was showing you on that other picture. I would show my patients this very important fatty acid right here has all these double bonds in it, linoleic and alpha linoleic. Those are the only two essential human fatty acids, not EPA, not DHEA. We have delta desaturated systems that allow us to make EPA and DHA, okay, downline. But you have to eat linoleic and alpha linoleic acid. You have to. It's the only two human essential fatty acids. So that's why I sought to find a source that would help my patients, get that. And then it also comes in a liquid form. Some people like to mix all three of these together in their water in the morning. And it works out beautifully. So I'm helping them see what I'm doing. I'm helping them understand this. I'm using my foosball exam. I'm using my pictures. I'm pinching my cheek to say that's what we're made of. And then they realize I care. They really realize, that this is we're designed to heal. Written in the book, in Psalm 139, it says we're, written in the members of my book. That's the DNA in Psalm 139.
Dr. Ellithorpe, I would go so far as to say, this has been really, truly incredible, I think, for, anyone who's out there practicing, just to feel the way that you care for patients, the specificity of your protocols and so forth. I'm really grateful for you sharing that. I think we've done it on that topic. I guess we've never had you on the Functional Forum before. Actually, we never even met before this whole cycle, which I'm surprised because I kind of been around the block and met a lot of the doctors over time at conferences and seen that thing, but I think you've been here on the front lines. I want to ask you a question as a closer. So this brand, this thing that I created is called the Evolution of Medicine. And the reason we called it that is because, ultimately medicine is having to adapt to its new environment of chronic illness, right? But also there are so many evolutionary concepts within medicine that I think, you've identified even some here today, like what we eat and what we're adapted to eat. So I guess I just want to ask you, when I say the words evolution of medicine, what does that mean to you?
I think it is talking about, will a human doctor stand for humanity and his patient as a fellow brother and sister? And will he or she go the extra mile to look something up, to second guess their own bias, to second guess their own preconceived or convenient training programs, and let them evolve into the best doctor that God wants them to be? That's how I see it. And I don't want a person who took a vaccine to feel bad. Many patients, I would say maybe 15% of my patients took the vaccine, and they did it because they were trying to care for an elder, or they were bullied or something. I want everyone to forgive their patients and say, let's begin better health today. And that's why we have such good success with weight loss and mood and things like this. Remember, your mood and your gut are connected very intimately with the vagus nerve. So I would like my fellow doctors to evolve into being servants as well as teachers, you know?
Beautiful.
And that is, there's a connection there in clinical medicine where that patient knows whether you care or not. And that's what we need.
Absolutely. Well, thank you so much for coming and sharing your wisdom. You know, we missed Dr. Nicholson today, but what I'm going to do is I'm going to catch up with him, and I'm going to record a special podcast with him to get some of his insight. But you more than made up for it with your incredible presence and value that you've offered here. So I'm really grateful. We've touched on so many, you know, critical topics here tonight. So I think this has been a really great education for anyone who's been listening. Thanks also to Dr. Mike Ash for his contribution and all of your contribution to this field. I feel like this is a, you know, really critical topic for understanding, you know, how we deal with chronic inflammatory illness, and super grateful for it. Next month coming up soon, actually in 3 weeks time, because it's the 11th today. So 3 weeks time today is August 1st. We're always the first Monday of the month. So on August 1st, drug-induced nutrient depletion and deprescribing. We've got a couple of pharmacists that we're going to be speaking to, and some doctors. We're going to be talking about the way in which medication depletes nutrients and how to go about bringing patients back into equilibrium in the face of that. It's going to be a great episode. I hope you can join us there. But in the meantime, you know, thanks so much for joining the Functional Forum. We've been talking about fatigue and lipid replacement therapy. I think we went into different areas than I was expecting, but I think that was really healthy, and very grateful for everyone here tonight. So thanks so much for tuning in tonight. This has been the Functional Forum. Thank you, Dr. Rita Ellithorpe.
Thank you for
what's
what
the name
your
of
work.
Of course.
What's
your website if people want to find out more about your work?
tlcdoctors.com.
All right, tlcdoctors.com. Great, and we will put all of the notes from some of the stuff that Dr. Nicholson and Dr. Ash and Dr. Ellithorpe have been working